Good morning, and thank you for joining us today on our Facebook Live. I'm Kelly Hawkins. I'm the Director of Public Information and Government Affairs, and I'm joined by Jazzy Landis, and she is a research scientist in SRHD's data center. And we're going to talk about Spokane's recent Community Health Needs Assessment, which is this beautiful project that Jazzy leads. A few weeks ago, we talked about SRHD's 5-year strategic plan and its first goal to be visible and trusted in the community. So today we're going to look at that second goal, and that's to be a model for evidence-based decision making. And SRHD's data center, they are amazing at showing the district's community to evidence-based practices. They collect and study reliable data, and they turn the facts into clear insights that benefits the community and helps guide our decisions. So Jazzy's work on the Community Health Needs Assessment is a perfect example of this second goal in action. Hi, Jazzy.
Hello.
Thanks for joining. Good morning. So talk a little bit, how does SRHD's role in creating the Community Health Needs Assessment reflect our commitment to using evidence-based decision making?
Yeah, so designing effective programs really requires us to have a strong understanding of our community's health status, looking at health and well-being of people who live, work, and play in Spokane County. So I love to use road trips as a metaphor for community health improvement. So say we want to plan a road trip. We have to know where we are, where we're starting, as well as where we want to go, and then we need to know what resources we have to get there. To understand where we are in terms of community health, we ask questions like, what skills and strengths do people have in Spokane County? And what's the status of health behaviors, health outcomes, and mortality? And we answer these questions by talking with community and by looking at different data. And community health is like most things in life, so it's constantly in motion. And our programs and services really have to adapt to that to make sure that we're as effective as we can be. And so we use the Community Health Needs Assessment to do things like allocate our resources, design new programs, and modify existing programs to make them more effective. So our commitment to evidence-based decision making is also the reason why we disseminate the findings really broadly, because it's not just about us acting on evidence, but also other organizations in our community.
Right. It's really a great way for us to also be collaborating with our community members and giving them tools to be able to do more within the community to help us each, all of us, everyone in the community be healthy and well.
Absolutely.
Talk a little bit about the process. What steps did SRHD take to collect and study the information to ensure that the findings were reliable and actionable?
Yeah, so it's kind of a long process, but the first thing we do is we check the design of our research and we check our data to make sure it's good quality data. So what that looks like is using standards for data quality, suppressing small numbers where we don't want to risk people's confidentiality, and suppressing things that have high missing rates, so making sure that we're not making decisions on data that isn't reliable. And then we also look at standards like well-known public health practices, and we kind of stand on the shoulders of giants in the way that we look at other assessments to see what worked really well in those communities, what might work really well here in Spokane County. And then we make our decisions about design and what to include or exclude. And then to make sure that our analysis is reliable, this is where, forgive the cliche, but I'm going to say it, teamwork makes the dream work. So we really involve other staff and people in our community to review the data and the assumptions that we're making about the data. So we invited, for example, a bunch of teams internally to do what's called a substantive review of our draft to make sure that we're hitting good metrics for quality, for accuracy, and for the completeness of our work. And then we also engage community by doing an activity called collective sense making, and that is where we brought in community to look at the raw data itself to see if there are insights that we didn't see ourselves. And for example, a really cool insight that came out of collective sense making was that third spaces, which are places to socialize that aren't work or home, seem to be disappearing or becoming more unaffordable in our county. Mm-hmm. And so that was a really unique insight that came directly from community members. And then at the end, we have all this data, so what do we do with it, right? We have to prioritize our issues. And so we used a robust prioritization process. I'm not going to bore you to tears with every step of that.
I wouldn't be bored.
But in the final round, what we do is we evaluate the feasibility of the issues. So we have a list of issues, and then we ask questions like, are there economic consequences if we don't address this? Or something like, can the issue be solved through community intervention to make sure that it's actually actionable?
And you touched on some of the findings that you have throughout the process. Again, a lot of collaboration. Were there some key challenges that the data revealed?
Yeah, absolutely. So we identified 3 priorities in the process. So the first is that many households are cost burdened in Spokane County. And what that means is that they spend 30% or more of their monthly income on housing costs. And so we know that causes challenges in health because when people are cost burdened, they're less likely to spend money on things like healthcare, which is still a necessary thing, but they prioritize their housing costs first. The second issue that we saw was substance use. We know that substance use is seriously harming our community, and we know that deaths by overdose increased from 2019 through 2024. And the last major challenge that we identified was mental health challenges like anxiety, trauma, depression. We know that those are affecting the health and well-being of people in our county. In 2023, 1/3 of youth felt so sad or helpless or hopeless that they stopped doing some of their normal activities. So we know that's a challenge for both adults and youth in our county, and so that's why it made the top 3 issues.
Yeah, and looking at those from a research scientist perspective, were there anything that surprised you or stood out to you?
Yes, oh my goodness. I really loved the community voice part where we were talking to community, engaging people, listening to stories, and just hearing what they had to say about life in Spokane County. So what stood out to me is that people love to interact with each other. They find joy in spending time together, and that's their friends, their family, even people they volunteer with. So I saw a surprising element around this, which is that people tend to gather around food, and food had a really big role in people gathering and having fun together. So we heard stories about things like barbecues, picnics, Sunday dinners. People traveled to orchards to pick fruit together. So that was really interesting to me, just to see how much food was a central aspect of how we socialize in Spokane County. And it makes sense, right? Food's one of our most basic needs. So it was very cool to see how food really facilitates a sense of community and a sense of culture in families, friends groups, and neighborhoods.
And we have a great food culture
Yes, we
in
do,
our community that helps with that. So I think it's great. Some great restaurants, great farmers markets, great things. So I can totally see that. Yeah. So how can community leaders, organizations, and residents use this evidence to help guide their decisions and help improve health in Spokane community?
Yeah, so everybody has a role in community health, and you don't have to read the CHNA or the Community Health Needs Assessment from cover to cover to use its findings. People can really look at the table of contents, and in the back of the report there's an index of indicators, so they can find the data that's most important to them. And people can use that data to make healthier choices. So residents, for example, can make healthier choices with their friends and their family. And they can also use the information to make their neighborhoods healthier. So a good example is maybe somebody challenges their friends to a fitness challenge using something called a commitment contract. And that's where people put in money, and if you don't achieve the goal, you don't get your money back, and it goes to something like a charitable donation, or it's split across the winners. Walk to Mordor is a good challenge for any nerds who may be tuning in with us.
Oh.
And then community leaders and organizations can use the results to align the programming that they're doing, align their priorities with what the community needs health-wise. Organizations can use it to allocate resources to influence the behaviors of people they interact with. And so an example of this is it could be something as small as a human resources team working with an IT team to create a desktop shortcut to their employee assistance program resources. Or it might look like something like a small community group hosts regular events specifically designed to develop found family relationships among people in the community. There really are 1,000,001 ways that people can do this type of work. And so I recommend that people keep two things in mind as they're looking at the data and trying to use it. So the first is to do what you can with what you have. And the second is that improvement doesn't have to be costly to be impactful. The tiniest changes can snowball over time and make a really giant impact in something like a family or a neighborhood or even an organization. So it's really about do what you have with what you have and doing the best that we can together.
I love that. I love how you showed it can be a resource for us as individuals or a variety of different communities, whether it's your work community or your neighborhood community. Or one thing that came to mind is it's fantasy football season. Everyone's thinking about their draft. How can you incorporate a physical element into that challenge? You know,
absolutely.
not just watching the games. Maybe you run or something at halftime. I don't know.
Yeah.
So yeah, I love those ideas, and so I encourage everyone to take a look on our website, and we'll include the link in the comments to the Community Health Needs Assessment, and check out some of the great ideas and the data and the information. It's really fascinating, and the things that we can do as a community to help make it a healthier place to live. And so thank you, and we'll see you all again next week.